Hello everyone. Today we are discussing one of the most critical skills for a biostatistician, how to talk to clinician. It's not just about the math, it's about communication. We need to build bridge, not barriers. Let's first acknowledge the fundamental difference in how we think. Clinicians and statisticians live in different worlds. A clinician focuses on the patient and the feeling of improvement. A statistician focuses on the data and the proof. Success in trial depends on your ability to translate medical significance into statistic parameter. You are the bridge between a feeling and a fact. How do we start this translation? Whenever a clinician uses a qualitative word like better and improved, you must ask the magic question: how do you measure that? We need to find the metric. Is it a blood test, a pain scale, or a survival duration? If you can't measure it, you can't analyze it. Once we know the metric, we need to define success. There is a difference between clinical and statistical significance. A clinician cares about the data, the minimum differences that would change their medical practice. We care about the p-value. Can we prove the observed differences isn't due to random chance? Your job is to make sure the trial is designed to detect a data that actually matters to doctors. Statisticians often have to say no, but you must do it wisely. Clinicians often want to make everything a primary endpoint, but we know that leads to the multiplicity problem and a huge sample size. Instead of just saying no, explain the trade-off. Show them that focus on one clear objective increase the power and credibility of the entire trial. Let's look at some examples of this translation in action. Look at this table. When clinician says the drug makes patients feel better, you should hear change from baseline in VAS score. When they say live longer, you hear heart ratio. Mastering this inner dictionary will make you a much more effective leader in any clinical project. To wrap up, let's look at a checklist for your next meeting. First, avoid technical jargon like heteroscedasticity. It doesn't help the conversation. Use clinical examples. Always ask what decision will be made based on the results. And most importantly, remember you are a partner in the research, not a gatekeeper who just says no. Final thoughts for today. The best statisticians are the ones who can speak the language of medicine. If you can understand the clinician's heart, you can design a study that truly service the patient. Thank you for your watching. I will see you in the next topic.